I think my mind works best when I walk. That's something that relaxes me. That's something that all of my family can do at any given time, even if we have got an hour of time to spare. I like walking, strolling in my office, even when I'm alone and I'm thinking about the next project. My name is Pawel Kalinski. I'm Senior Vice President for Team Science at Roswell Park Comprehensive Cancer Center and Jacobs Family Endowed Chair of Immunology.
At Roswell Park, we have a vision to be the global destination for cell therapy. I really believe it's the future. It's the innovative future. And it was really important for us to have the strongest team that we could. The first person that we recruited for that program was Dr. Pawel Kalinski, and he has set the groundwork to build the cellular program on.
Roswell Park is one of the very few, if not the only, cancer center at this moment which can look at the immune response against cancer in a very comprehensive manner. What's the enemy? What's this mutated cell that tries to kill the patient? Why when we got the flu we are awfully sick for the first 3 days and then we completely heal? Why when we get cancer nothing happens for years sometimes and then it's too late to do anything? That's why awakening immune system is so critical to complete the treatment of patients so that not only they can be treated but they can be cured.
Pawel has taken a concept of dendritic cell vaccines that had been languishing for years, and through additional research in his own laboratory was able to make this next generation of dendritic cell vaccines for cancer a reality and a potential significant therapeutic option for our patients.
Dendritic cell vaccines, that's something that we've been doing for quite a while, and we've got very promising results.
We design clinical trials, we open clinical trials in our clinics, we enroll patients. I discuss with Dr. Kalinski, we review the clinical data, we look at what happened in the tumor, and then we try to design better treatments in order to improve clinical outcomes for our patients.
Pawel's really into team science and collaboration, so we're collaborating with several other scientists and clinicians, which is really important for developing clinical trials.
He's bringing in science and investigators from other institutions.
We have very active collaborations with Moffitt Cancer Center in Florida, with University of Pittsburgh in Pennsylvania.
What we really want to understand is incrementally, how can we promote the infiltration of the right type of immune cells? Because immune cells have both good guys and bad guys. And Pawel's expertise and his foundational cell production facilities at Roswell Park have been absolutely critical for that to happen.
So it's putting our science out into the world and people acknowledging the significance of it.
One of Pawel's great attributes is how he bridges basic science with clinical research. And he does that through close collaboration and mentorship.
I feel like I'm learning something from him each time. I've worked on several clinical trials with him. The way he comes up with his approach of dendritic cells is very novel, very unique.
He has a really strong history of driving science from the bench to the bedside. We've had several clinical trials that have started with work that we've done in the lab that's directly informed the clinical trials. And these are already helping benefit our patients.
Some of the most rewarding aspects of my life, seeing a patient who's been in really bad shape and suddenly she or he is fine 10 or 15 years later as a result of our treatments. This is extremely rewarding.
I mean, there's no question, he loves what he does. One of the most passionate people I've ever met. He has so much energy and life when he's talking about his science.
He not only makes the institution better by providing this foundation for cell therapy at Roswell Park, but in addition, he's training the next generation cancer doctors, immunotherapists. And that is really what's necessary to take us, our patients at Roswell Park, and more globally, cancer therapy to the future.
You know, he's somebody that is going to take all of us to that next level. He's an important person.
Now the next step is how to make sure that what works in one patient out of 10 will be working in one patient out of 2, or eventually will work in 80% of the patient. That's the work that I hope to complete in the next 15-20 years of my life.